Welcome to the Health Rising podcast, where we empower you along your health journey. I'm your host, Dr. Jordan Salmon, and together we'll explore the steps to greater health, hope, and happiness. Let's rise together. Hi there. Welcome back to the Health Rising podcast. I'm Dr. Salmon. I thought that one of the best places for us to start would be at the end. So that's Stephen R. Covey's habit number 2 in 7 Habits of Highly Effective People, right? Begin with the end in mind. So I think it's really important for us to understand where we are trying to get to. So if you imagine that you were meeting up with a good friend and they told you, hey, let's go meet at Buc-ee's. And you think, well, Buc-ee's is a great place. Let's go meet at Buc-ee's. And so you have this, you're going to go meet at Buc-ee's. And so you get in the car, but you realize which Buc-ee's, right? You need to know exactly which Buc-ee's you're meeting at for in order to be together with your friend. And maybe you always go to the same Buc-ee's, and so it's already just implied. But if you don't know exactly where you're both going, then you may end up in completely different places. And that's important with health, right? If we don't know exactly where we're trying to end up on this health journey, oftentimes we can get frustrated. And those frustrations can kind of confuse us and make us think that, things aren't working. But really, it's just that we have a misunderstanding of where we're actually trying to go. So I hope to dispel some of those myths about health. I want to talk about some of the things that health is not, which I think was pretty powerful. And then I'll get into a little bit of what health is, at least how I see it. So, first thing that health is not is it is not the absence of disease, sickness, or pain. So, this is an important one, and I think it's often missed by many people, right? We think I have such and such disease, so I'm unhealthy. I'm a diabetic, or whatever um, issue is going on in our lives, and we think that suddenly now we're unhealthy. And this is not true. So when we talk about health, it's critical to recognize that there are these two important contrasting realities that coexist at the exact same time. So number one is that you are human. And as a human, you're subject to those very things that make you a human, which is disease and sickness and pain, right? And the unfortunate reality of living in this human existence is that not every human will have the exact same diseases. Or maybe that's not unfortunate. Maybe we're grateful for that as we look around, right, and see what things people struggle with. But we might be the one that seems to be afflicted more with some of these challenges, health challenges. And it's important that we accept that this is just part of the reality of living as a human. And that doesn't mean that you're unhealthy. It just means that you're human. And part of the process is learning to be a victor, right? So be victorious over these diseases that we are afflicted with instead of becoming the victim in this pathway to health. And one of the ways that we do that is we don't label ourselves by our diseases. So I said, earlier, I'm a diabetic, but in reality, you're not a diabetic. You're you, and you're a human who has a body that's dealing with diabetes. And you are not the diabetes. You are you. And sure, your body is dealing with this challenge. And there are likely changes that you can make in your life to make it easier to deal with this disease and possibly overcome the disease depending on kind of where you're at with this disease process. But getting to a better place, with kind of a better balance with your disease is part of the process of improving health, right? So again, like if you you say, I'm an anxious person, right? That's defining yourself by this challenge that you're dealing with. Instead, you're an individual who just struggles with anxious thoughts, and learning how to improve those thought patterns and those emotions, and how to manage them or live with them is part of the process of improving your health. And that's a critical thing to recognize. So that first reality is that you're human. And as a human, you're subject to those things that make you human. But on the other side of that is the alternate reality. You will face, you know, those trials and challenges that make you human. And despite all of that, though, you have the power to choose, right? You have control over many things within your life. So, as an individual who's dealing with diabetes, for example, right? So your body is subjected to this disease process, but you can also change some of that process by the foods that you purchase, the foods that you put on your plate, the meals that you prepare, or whatever you eat, and your exercise, and the way that you live your life, right? All of these things are things that you still control, and you will always control those things despite the fact that your body has these limitations or challenges or struggles or whatever it is you deal with. Maybe a better example for number one is that you have your genetics, right? So you have been born with certain genetics that you have no control over. But the contrast to that is, despite these genetics that you are given, you still have the ability to choose what you're going to do and how you're going to move forward, right? And recognizing that those two kind of contrasting realities actually coexist at the same time is, I think, a critical foundation for improving your health, and learning to just accept and be okay with the reality of number one, that first reality, while taking control and recognizing that you do still control many things in your life. I love a quote by Viktor Frankl in Man's Search for Meaning. The one thing you can't take away from me is the way I choose to respond to what you do to me. Right? So in our own existence, in our own earthly, this life that we're given, there's things that just happen to you, that are given to you, but recognizing that you still have power within you to make choices and to change how you go forward, can be really life altering, and I think really empowering. It's so amazing to me to see individuals who begin to take more actions to control those things that are able to be controlled in their situation with whatever is going on in their life. And the most amazing thing happens, that as they make more concentrated, intentional changes and work to focus more on what they can control, what's amazing is oftentimes the things that were previously thought to be uncontrollable, or you know um, regarding to number one, those that first reality where you know things in life happen and you can't necessarily control it, but as you focus more on what you do control, you find that the things that are thought to be unable to be controlled, many of those things are more controllable. Now, that may sound a little confusing. So I thought that I would review an example. Cancer is commonly thought to be uncontrollable, right? That you just get cancer. And, obviously that's an overgeneralization, and there's a lot of examples where that's not true. But I think in general, a lot of people think of cancer as this thing that I don't have any control over, and I just get cancer, I don't get cancer. And I'd like to review a specific cancer, or esophageal cancer. And one of the ways that you can get this specific cancer is from essentially a transformation of the cells due to long-standing acid reflux, or GERD. And this is called, um, well, you have what's called Barrett's esophagus, which is where you begin to see changes in the lining of the esophagus. And these changes occur due to having acid continually splashed up into the esophagus. And over time, this can lead to changes in that lining of the esophagus. And in some cases, now this is not extremely common, so I don't want anyone to go home and worry because they have acid reflux. But in cases, people can develop cancer because of these changes that have occurred over long-standing acid reflux, or more specifically, gastroesophageal reflux disease, GERD. So there have been studies, though. One specifically that I was reviewing for the show was in 2013, and they helped individuals who had gastroesophageal reflux disease to lose weight. And all these patients were overweight to start. And as they helped them to lose weight, um, the majority of them had either complete resolution or, um, at least some improvement in their gastroesophageal reflux disease, in the symptoms. And so by focusing their time and effort on things that were within their control, they can affect things that are often thought to be out of your control. And when we take too much time focusing and spending energy fretting over the fact that we don't control things, such as cancer, it can lead us to kind of a sense of helplessness. And we stop making changes or doing things in life that can lead to improved health and can ultimately lead to reducing the risk of cancer in this specific scenario or specific example that I'm trying to illustrate. And I think that's such a powerful thing that has just been reemphasized over and over again as I have patients who have diabetes and are able to come off of insulin, come off of medications because of making changes in their life. And from my experience with obesity, I look at obesity as one of those things that are uncontrollable, because I don't think focusing on your weight and on your obesity does you very much good. I think it's important to try and lose weight and to get to a place where you are thriving and enjoying life. But focusing on your weight doesn't help you, because you can't control your weight. You can control things that will in turn affect your weight. And that's where your time and energy needs to be placed, right? If we're talking about weight loss. So, and I can talk about that in future episodes, so then you would focus on what foods you purchase, what foods you consume, how often you eat, lots of those types of things, uh, your exercise levels, how often you go out to eat, what you order when you go out to eat, All of those things contribute and can affect your weight, but focusing on your weight itself does you no good. And that's just been my experience. And recognizing kind of this counterbalance between these two truths is a bit of an art, right? Takes practice, but I think we can gain a lot more control in our lives. And despite really hard scenarios or hard diseases that we can be diagnosed with, we can still thrive and experience health and meaning and enjoy life. I'll share a story about a patient of mine. So there was a young patient, and um, we'll call him Jim. So Jim had to have his leg amputated at a young age because of various situations. And I think when you're faced with a situation like that, it can be really challenging, and it was for Jim. And if you look at that situation from the perspective of, my life is over, right? I'm an amputee. There's so many things I can't do. Then you're right, right? You've defined your life this way. You've defined yourself in this with these thoughts. But on that flip side, you can also say, while it's true that there are things I may not be able to do because of this new challenge that I'm dealing with, I still can do many things. Realistically, as an amputee, Jim could do just about anything he wanted to do. And the limitations are exist, but they are far fewer than the potential and the capacity and the impact that Jim could have in the future with life. If we're struggling with that kind of limited view or that negative viewpoint with our disease process or with maybe the hand that we've been dealt in life, I think it's really beneficial to start recognizing some of those things that you can do, some of the things that you have power over and that you can control. And that can really give you a lot of power and help you to begin to start making better changes and choices that will lead to improved health. So, another thing that health is not simply having a longer life. And this one, I think, is a lot of the efforts and time and things that we do in our current medical system is simply to extend life. And I'm not proposing that those are bad things, that we shouldn't do that. I think that they are excellent. It has blessed and improved the lives of many of my own patients. However, despite that, thinking that simply having more years leads to greater health, I think is a misconception. I like the phrase health is not the years in the life, but rather health is the life in the years, right? So I have two patients that kind of have contrasting views on this this very principle, right? So one of my patients, they had cancer and they were fairly young, a young middle-aged individual. We'll call him Ted. And Ted came to a place where he accepted his diagnosis and he lived his life to the fullest that he could with the limited time that he had left. And then he was ready to courageously move on and graduate from existence, so to speak, as people will say. And I feel like that is such a beautiful example of someone who lived healthy. Despite not having many years, their life that they lived was a life of fullness. And I thought that was just a beautiful example of someone who didn't have a lot of years, but was still able to make the most of the years that they had. And I think that's really what health is trying to get at. Now, I have another patient who, well, I, I'll call her Sally. So, Sally had a diagnosis of a blood cancer, but this blood cancer was very benign, meaning it was not causing her body any challenges, and she was likely not going to die from this blood cancer. But the idea or the thought that she had cancer was so distressing and so challenging to her that she started drinking and drinking very heavily and was admitted to the hospital multiple times because of the excessive alcohol consumption. And she was told multiple times that she needed to stop drinking. And I think this is one of the places where maybe we didn't do as well to help her, and to help deal with what was really at the core of her drinking. Nevertheless, she drank so much that eventually it led to her death. And despite having cancer and wasn't going to die from this cancer, she struggled to cope with this diagnosis of cancer. The reason I share this story here is because Sally was so focused on having more years in her life, and she was so worried about this cancer causing her to have less years that it affected her health to the point that the cancer itself was not the ultimate cause of her having less time, and ultimately led to a lot of anxiety, and she just struggled over that period of time with that diagnosis. Whereas if she had been able to come to a better place and be able to accept her diagnosis and recognize that, kind of going back to that concept of the two contrasting realities, right? That you have this diagnosis, and this diagnosis may ultimately lead to uh, an earlier death than what you had hoped. But at the same time, you can still do many things. You're still here at this time and can enjoy time with family, can enjoy, the wonderful things that you have available to you. And so being able to not focus so much on having more years, but being able to just recognize that you have today and can do things today is really powerful and helps to improve health. As we attempt to define health by not by the number of years, but just by how you live each day can be really helpful. Because in the end, ultimately, to be human is to die. Every human will eventually die. And obviously, it is difficult when someone dies much sooner than anticipated. And that's a hard thing to go through. I'm not discrediting that. But I think sometimes we forget that more important than avoiding death is to choose to live today. I like a quote by Marcus Aurelius. He has many quotes about death, but one that I really like is, "It is not death that a man should fear, but he should fear never beginning to live." And the next one I want to talk about is health is not purchased with money, right? Monetarily. And I think, unfortunately, our medical system is kind of built on the very premise that you can purchase health. And sadly, I think we teach that. And I'll hopefully get into that in maybe another episode. But this idea that with more money, you can purchase health is just not true. A doctor can't make you any more healthy than a teacher can make you a lawyer or a scientist or whatever other profession, right? The teacher is very beneficial and helpful in guiding you, but ultimately you have to decide to learn and to put the time and effort into developing the skills and the knowledge in order to serve as that profession. And the same is true for the medical world as a doctor, and probably the one of the greatest challenges, but also one of the greatest joys I have as a physician is to help people to come to a greater understanding of this very principle that when you make the choice to improve your health and start making daily habits that improve your health, that's what will make you healthy. And you have that power within you. And you can't just buy it. It's not something that you can just purchase. You can't, you know, live a life of, with multiple unhealthy decisions, or, decisions that lead to poorer health outcomes, and then suddenly show up with a whole lot of money and say everything's going to be fine. And that's just, one of the, I guess, the challenges of health, but it's just the reality. On the flip side, I do recognize, and I'm not, trying to portray this image that money isn't beneficial or helpful at all. I think that money can play a role, and there are a benefit to having the money, and you can definitely pay for certain things. But the thought that I don't have enough money to be healthy, I think is just a mistaken concept that is often portrayed in our healthcare society and potentially perpetuated by the current medical system, which hopefully we can change and kind of start changing that. Now, the next one that I have is health is not merely appearance. And this is I think, a commonly misunderstood mindset that a lot of people will have, right? We go to the doctor, we go to a medical professional to try and help with the appearance of, our skin, of to have procedures performed, all these other things in order to appear better. And I'm not proposing again that that's not something that you can do or benefit from, but I recognize that you can still have deep sense of health when you do not appear maybe the way that you wish you did. And there's a lot of mental health disorders that deal specifically with this challenge that individuals struggle with, right? Where they view their appearance in a way that can cause a lot of suffering and can be a really difficult trial to go forward with. But the concept that you can simply go and change your appearance and suddenly you're now healthier, I think is just an incomplete understanding of what health really is. The next one that I have is that health is not measured. So, as doctors, and especially as a society, we love to measure things. We measure so many things. I've followed LeBron James, I think, recently passed the record for the most amount of points scored in his regular season career, outside of the playoffs. And there are measurements that we have for just everything to define people and to say, like, oh, how much money do you have? How much money do you make? That's a common question, right? When we learn about someone, right? Oh, well, how much money do you make? And then suddenly that determines the value of that individual. I think in some of our mindsets. And so it's a common misconception that we have here in health as well, right? So we measure your BMI, we measure your blood pressure. We do this lab work that tells us, exactly what specific blood levels are, and there's all sorts of things that we can measure. And then we can say, oh, this needs to be smaller, this needs to be bigger, and we can obsess over these things. Weight is a common one, right? Where we're going to obsess over this weight and getting you down to a specific weight for your height. And um, getting down suddenly to that weight does not instantaneously mean, oh, okay, now you are healthy. And this is something that I found within myself, right? As I got to a healthy weight, I had lost 65 pounds and got to a healthy weight and was at a much better place from my weight standpoint. but I still struggled quite a bit with having days of not eating the way that I wanted to. And I would eat things that did not feel good for me and for my body. And so this concept that, just getting the right numbers in place suddenly means that you're healthy is just a kind of an incomplete picture. Kind of like a puzzle, right? These measurements are little tiny puzzle pieces in a giant puzzle that has way more than just those little measurements. And those little measurements are trying to give you, you know, a picture view of maybe how your health could improve, but ultimately your health is determined by way more than just what is measured. So we spent a long time talking about what health is not. And I like to do that because I think there are these things that individuals just, we hyper focus on some of these concepts or some of these ideas, thinking that once I get this, then I'm healthy. And I think that that just kind of simplifies health a little bit too much. I will read the WHO has a definition for health. They say health is a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. So I like to consider health as a balance, right? It is a complete balance of multiple different aspects in our lives. And there's lots of little component parts. We love to talk about mental health, and we'll talk about your physical health or your emotional health or your spiritual health, right? But ultimately, health is all of those in one. And being able to have an appropriate balance of where everything is at. And there are times in our life when maybe one aspect of our health needs more of our attention. And so then that's good. So spend some more time on that. And some of the other areas where you wish you could spend time, but maybe are doing much better, you can kind of put them on the shelf and say, this thing that I want to work on is just at a good place right now. And I really need to focus on this other thing. And so then that can help you to just recognize that yes, those all of those aspects are important for your health, but being able to balance everything and work on everything together and recognize that each component part is just one piece of your giant health puzzle. So recognizing this, I think an important thing to remember is that health is you, right? You make the decisions every day. And this is important to recognize. As a doctor, I see my patients for, fortunately, now with my current practice, I can see patients for a much longer visit. Um, but even still, I don't see them every day, and I'm not seeing them, you know, even every week. So you are with yourself every single day, and you eat food every day, and you drink water, or, and you engage in activities, and you go to work, and you do all these things that contribute to your health, including your thoughts, right? So you're thinking continually, and your brain is having regular thoughts about yourself, about your day, about your interactions, and everything. And so all of these things are the component parts that make up your health. And I love to look at health as a decision, right? It is you decide every day how you're going to be, how your health will be for that day, and engage in practices that help you to obtain that improved health for yourself. It's like a journey. I love talking about it as a journey because it is a process of discovery, right? Where we are just trying to become the best that we can become for ourselves. And suddenly, something may happen that can affect our health, even dramatically, receiving a new diagnosis, having a traumatic incident. There's all sorts of things that occur, and that's generally when someone will seek medical advice. But how you respond to that situation and how you move forward in the face of those experiences that are human is part of the process of improving your health and growing into a better, healthier version of yourself, even if that version of yourself is a new person than what you thought you would be at that stage in your life. So then what exactly is health? Health is a dynamic and multifaceted state of well-being that encompasses physical, mental, and social dimensions. It's this balanced integration of multiple aspects of life, including your physical health, emotional resilience, social connections, and personal fulfillment. Health involves acknowledging and embracing your humanity and navigating through challenges with resilience and actively making choices that contribute to your overall well being. It's a continuous journey of self discovery, growth, empowerment, and striving to become the healthiest, happiest version of yourself, given your specific stage of life, one mindful decision at a time. Health is it's being intentional with our actions to secure those most important things in life. Health is facing the difficult life challenges with determination to improve our situation while concurrently exercising patience with those aspects that are out of our control. Health is having a vision for the best version of ourselves and making daily choices that move us closer to becoming that person. Health is being present each day, despite the experiences of life that remind us of our humanness and the humanness of others. So there's a lot of habits, behaviors, thoughts, and things that we can do every day that affect our overall health. And everything is interconnected as well. I love talking to patients. One of the questions I love to ask patients who have lost a significant amount of weight is, what's different? And I've received some very interesting answers, right? Some people will tell me that their skin is better, and some people will tell me they just have more energy. For me, one of the greatest benefits was my confidence improved, and I recognized how much I could do, and I recognized I was holding myself back. And so all of these things are just ways that we improve our health, and you're working on one thing and you see that kind of your whole health experience will improve. So we're going for this place. It's kind of not it's difficult to describe, but essentially it's just the healthiest, best version of you that you can become at this stage in your life, and doing what you can each day to get there, and giving yourself a lot of grace in the process because, it generally requires changes. And I don't think anyone is perfect at this, and that's okay. You're human. So extend yourself that grace and just recognize, I really want to improve this aspect of my health, and then go get it. And those are the things that I hope to address in these next episodes and talk more about that. But lastly, I just want to say that health has no finish line. There's no arrival point. It's not a destination that you get to and then you're done. Uh, we talk about that health is not a measurement, right? You can't just get to a certain weight and then it's over. And that's one of the big challenges I deal with my patients who are struggling with losing weight, because they have this goal of getting to a certain weight loss, And then they say, okay, well, now I've arrived, so I'm done. And then what happens generally down the road, they regain all that weight back. And it's a cycle, and that's a challenging thing to deal with. And I think that's thinking that health has a finish line, or that, it's based on these measurements, and so we think that we've done it. But in the end, realistically, health is just a continual process of living each day, trying to get a little bit better, making smaller goals, and working on things, and trying to catch ourselves when we see us going back to previous ways of living that were not as healthy, and where we didn't feel as good, and where we weren't as, we didn't enjoy life as much. And so in this process, we can continue to grow, continue to learn. I think the benefits of working on our health are worth it. They are so The number of benefits that patients receive from trying to improve their health, I can't even count them all, right? That's why I love asking patients about, the benefits, because people will tell me things that, even as a doctor, I didn't even expect certain results from certain changes that people make. But this health journey, it's uh it's a one day at a time, and it's having this overall vision of who we want to become, recognizing that it's going to come very slowly, like the sun coming up, right? That each moment there's a little bit more light and a little bit of improvement. And we'll get to a place, then we'll look back and we'll say, wow, I have come a long ways, and I love it. I love where I'm at. I love how I feel. I love this life that I have, and I'm not going back. And that's where I want you to get. That's the vision of the healthy future that is possible, and that is continual progression, right? Of just becoming better every single day. And that's what I want to get into next. So that's where we'll be headed then in future episodes. I'll close this episode with a thought by James Clear. He's an author that I think is really powerful and helpful in understanding habits and improving our habits. And he had a quote. He says, "Every action you take is a vote for the type of person you wish to become." And I think that concept pretty well encapsulates this idea of health is kind of a daily choice, just a daily improvement, and every day voting on a healthier version of ourselves, and recognizing that the old version of ourselves is still there, and we're just trying to not continue to go back to that person. Thank you for joining me. I hope this was helpful. Hopefully, I don't mean to offend anyone if, when I talk about some of these things, I know they can be really difficult, especially for patients who are going through really challenging things with their health. But I mean this to help you. And if you have questions, concerns, send me an email. I'd love to hear your feedback, and hopefully we can improve our health together. So thank you. Thank you for joining me for this episode of the Health Rising podcast. I practice as a direct primary care physician in the Houston, Texas area. You can read about my blog and learn more about direct primary care at healthrisingdpc.com. If you have any questions or thoughts you'd like to share, feel free to message me on X or on Instagram at healthrisingdpc. Until next time, remember to choose health and be kind to yourself. This podcast serves solely for educational purposes. The information provided here is not intended to be medical advice. Listening to this podcast does not establish a doctor-patient relationship between the host, guests, or anyone associated with the podcast and the listener. For personalized medical advice tailored to your specific health concerns, please consult your own family physician. Any interactions with patients or experiences shared in this podcast have been altered to ensure confidentiality and comply with HIPAA regulations. Names, genders, diagnoses, and any potentially identifiable information have been modified to protect the privacy of individuals. By continuing to listen to the Health Rising podcast, you acknowledge and agree to these terms.